Your CRMA report helps you to determine the severity of grade in the Croft treatment guidelines. Take a look.
Okay, this is one of the most important. Actually, everything that the CRMA gives you is important, but this allows you for placement in the Croft treatment guidelines. So remember, in the Croft treatment guidelines, they're guidelines to determine your frequency and duration of treatment. So it's a separate grading system. It's not a sprain grading system. It's a Croft grade of injury system in order to place the patient in so that you get your frequency and duration of treatment parameters that would be acceptable. So if you look at a grade 1 injury, you're not going to see any ligamentous injury. Grade 2 injuries show no ligamentous injury. It's only when we get to a grade 3, so if you have abnormal findings in the report, you're at a grade 3. If you have rateable findings in the report, you're at a grade 4. Now, again, this isn't a program to teach you how to use the Croft treatment guidelines. We assume that you know that. We just want to point out the fact that when you have abnormal findings, you're at a grade 3. When you have severe findings or rateable findings, you're at a grade 4. And we look at a grade 3, it allows for up to 76 treatments in a 56-week treatment duration. Now, again, this is not a course on the Croft treatment guidelines or how to treat a patient or anything else. All I want to be able to do is point out to you that when you have abnormal findings, you have a grade 3. When you have rateable findings, you have a grade 4. Now, I want to show you one additional resource to explain just how important this really is. Okay, if we look at the Croft treatment guidelines, we're going to go to Oklahoma here. And when we pull up the Oklahoma site, this is the site of chiropractic examining boards, it's going to give a really nice PDF that I'll download and actually put in your attachments down below in the video. But one of the things that I want you to know is the importance of this really shows up. And let's actually scroll down here just a little bit. Okay, use until the State of Oklahoma Board of Chiropractic Examiners adopted these guidelines. File reviewers and IME doctors working for various insurance companies, HMO, PPOs, etc., were left to their own devices for determining reasonable and customary treatment schedules. This often led to unreasonable denials of care, on individual biases, and reliance on unscientific literature. For example, the theory that most CAD injuries resolve in 6 to 12 weeks simply hasn't been able to stand up to scientific scrutiny and is overly sanguine. Yet it's extremely prevalent in defense circles. Similarly, many operate under the misconception that injuries are unlikely in the absence of significant property damage to involved vehicles. Again, the evidence to support this view is lacking, while the countervailing evidence is overpowering. But here's the part I want you to notice. Now, peer reviewers and IMEs alike are required to follow the guidelines above. If you list that you use these guidelines, then these are the guidelines that you'd be judged by. Now, look at the next paragraph. I recently spoke to a chiropractic group in Florida. The organizer related an interesting story. It seems that several years ago, the state had adopted a peer review system that had identified his young associate as having overtreated a female patient. This alleged overtreatment was based on the opinion of one reviewer. It can happen all the time. Subsequently, the Attorney General's office seized the chiropractor's records and launched a long and drawn-out investigation of the possible insurance fraud. The potential ramifications of this investigation, in addition to large attorney's fees, included loss of licensure and even prison time. The case dragged for 2 years. Now imagine what this doctor was going through just simply because they didn't document, and simply because they weren't, basically stating in their documentation exactly what grade they had. So this case dragged on for 2 years. Finally, the file reviewer was deposed by the associate's attorney. The attorney noticed the reviewer's CV included a reference to having been through the Croft training program in whiplash. Now remember, in the documentation of the original doctor, no Croft grade of injury, therefore not using guidelines and showing guidelines in your documentation. It's important to do this. So the IME, the attorney, sees that he's been through the Croft treatment guidelines or Croft training program, and he was asked if the program was scientific, whether he subscribed to most of the theories taught, answering in the affirmative. He was then shown the textbook and the patient's medical records and asked to determine the patient's grade of injury. He then was asked to look at the guidelines and state together whether her treatment had been either reasonable or excessive. Since she had undeniable neurological involvement, she fit into a grade 3 category. This reviewer then looked at the attorney and said, I guess the treatment was reasonable. The AG's case was dropped. It's important to document these things, and that's the beauty of a CRMA. It's unbiased and independent, and it allows you to grade the severity of sprain, place the grade of injury in the Croft treatment guidelines, and as I'll show you, it allows you to determine if you're going to have a patient that may need a surgical intervention. If you have return to play parameters kicking in where you have to restrict an athlete from contact sport for a while until the injury heals up, it's going to allow you to make better MRI referrals. There's a lot that this report does for you.